decision. Governor Larry Hogan is the governor of Maryland, also the chair of the National Governors Association. He joins us now. Governor Hogan, I want to get your reaction to the meeting that we just heard from that Andrew Cuomo sort of was heading up about cooperation amongst governors in trying to kind of figure out what a reopening would look like, based both on public health issues and economic issues.
Well, I think this is something that governors across the country have been talking about for quite some time. I didn't get a chance to really see or hear Governor Cuomo's press conference earlier with the governors in the region, but I know I've talked to a number of the governors there over the past few days, and I think it's a really good idea, the regional cooperation. At the National Governors Association, we've had ongoing discussions for weeks with governors about all the things that might go into reopening in the various states. Here in my state, we've been talking about this for almost 35 days since we first declared a state of emergency, talking with our scientists and our doctors, some really smart folks, including Dr. Scott Gottlieb, who's the former FDA commissioner, Tom Inglesby from Johns Hopkins, along with some of our business leaders, about how would we go about doing this in a safe way. So I think it's something that governors are taking the lead on and will continue to do so.
On the issue of governors taking the lead and on reopening the states, President Trump tweeted today essentially the opposite, that it's his decision, not that of the governors, only he didn't issue the stay-at-home orders in the first place. Governors did that. He essentially said he's the one who makes the decisions, the decision for the president, and for many good reasons. Is that your understanding? It doesn't seem that's the way it works under the Constitution.
Well, it's not my understanding of the Constitution, but look, I think we had a very productive discussion with the nation's governors, with the vice president and some of the top leaders just a little bit earlier today. We have some real cooperation going forward. Look, we'll be discussing with the team at the federal level some of their thoughts and ideas. There's some awful smart people at the federal level, like Dr. Birx and Dr. Fauci, who I'm sure will be weighing in about whether or not it's time to reopen and how we might go about doing that in a safe way. And we'd love to have the president's cooperation. But governors made decisions to take various actions in their states based on what they thought was right for their state, based on the facts on the ground, talking with doctors and scientists. And I think individual governors who made those decisions will have the ultimate decision about what to do with their states.
You and Governor Cuomo have asked Congress to give $500 billion in aid directly to states to help stabilize budgets. How would that be used by the states?
So one of the things, look, there have been a couple of stimulus packages which I think are really helpful to get our economy back on track. But what was missing, there were zero funds that went directly to the state governments to make up for any shortfalls in their revenues. And states are really in a position to be able to help get our economies back online. And we've also suffered major losses in revenue that we need to provide the basic services to all the people in our states. We took the tough decisions to shut things down and to put in place these tough social distancing practices, which are having an impact on the economy. And we need that help from the federal government so we can help get the economy back on track when it's safe to do so and when we're ready to get people back to work. So we've asked Congress to do so. There's a discussion there. We've made that pitch to the vice president today. I've talked with Secretary Mnuchin. We made the pitch to the president last week. I think we've got some support, at least generally, from the administration to try to help get the states and the governors more help. And in Congress, it's sort of tied up. We're just hoping they can put aside partisan differences and get this done for the American people.
We've seen, we heard today from a pork producer about concerns about the food supply, essentially. Plants closing because workers there often have to work shoulder to shoulder. There have been a number of infections in various food production plants. How concerned are you about those basic issues of people getting food on the table in your state?
Well, there's so many different issues. I mean, this is just one thing after another with this virus that that's a new one that just popped up. We're talking about the whole supply chain. In our state, it's not so much on the food production as the situation came up with the pork producers, but it's about getting all of those things to the people that really need them. So it's making sure that the things are being delivered out to the stores so that people can get the food and the things, the basic basic needs taken care of, and that they can do so and purchase those things in a safe manner. But it's certainly an issue that needs to be addressed. But letting people go back to work in an unsafe manner is not going to help get our economy back on track. If we just get more infections and more people sick, we overload our hospitals, that could have an even more detrimental impact on our economy.
Obviously, one doesn't have to sort of make these kind of decisions, but if you had to err on the side of public health or economic issues, I assume you would say you'd err on the side of public health.
Well, it's a terrible position for anybody to be in, because they're both really bad consequences, right? I mean, nobody wants to hurt the economy and put people out of work, but mainly we're talking about saving lives, and the difference between, you know, tens of thousands of people dying or bringing that down so we don't overload the healthcare system, that's got to be our first priority. But I'm also very sympathetic to those people that have lost their jobs, those small businesses that are being hurt. So we've got to listen to the doctors and scientists. We've also got to be really concerned about getting people the help that they need and getting our economy back on track, but doing so in a gradual and safe manner when it's really the right time to do it.
I'm wondering if you'd read the report by the New York Times over the weekend about the details about concerns about the response by the administration with social distancing, pushing that off until mid-March, despite earlier warnings.
Well, so, look, Anderson, I think the last thing that we need right now in the middle of this crisis, because I think we all have to be working together to get things done. We're all on the same team at the federal, state, and local level, and then the private sector. It's not the time to be talking about what went wrong. Certainly some mistakes were made, but rather than talking about what didn't get done yesterday or last month or last year, I want to talk about what we can get done today. We're making some progress. The federal government has improved and stepped up and provided more help to the states just recently, and I'm happy about that. But certainly, I mean, I heard some of the reports, and Dr. Fauci, who I have tremendous respect for, I saw his comments over the weekend. I mean, look, we took very early action and very aggressive action in our state, and I became really concerned about this and focused on it from early January. I can't speak as to why certain decisions weren't made, but right now I think we're all focused on it, and we're all trying to do the best we can.
Governor Larry Hogan, I appreciate your time. Thank you.
Thank you, Anderson.